Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now this is the time to return a lot to the word. The topic of today is Tinea corporis. Tinea in general is a common fungal skin infection, also called ringworm tinea. It affects any part of the skin on the body from the head to toe. Ringworm is not caught by a worm as the name is, but this fungal infection forms a ring-shaped rash. Other similar rash can look like ringworm, like spider bite, nodular eczema, and Lyme disease that present with the same ring-like appearance. But these are not fungal infection as the tinea or the ringworm. These are not very serious problem, but that is uncomfortable for the patient. So here one can see the tinea ring, and that is also the ringworm or the tinea corporis, and the tinea infection that can be on any part of the body mostly. So when it is on the different part of the body like chest, arm, leg, it is called tinea corporis. So this tinea fungal infection is by the dermatophyte, and these are the fungus which is responsible for the tinea corporis. Now, tinea corporis is also called body ringworm or tinea circinata or tinea glabrosa. It is seen in the glabrous skin, means smooth skin and the smooth surface of the body. A rash caused by a superficial fungal infection of the body similar to the other forms of the tinea, an itchy circular rash with clearer skin in the middle or the center of the rash. Ringworm got its name because of its appearance with ring-shaped lesion, and no worm is involved, a type of the dermatosis that can affect any superficial part of the body, excluding the hands, the feet, the scalp, face, beard, groin, and nails, because when these parts are affected, they have got the different names, not the tinea corporis. So tinea corporis exclude all these sites which are being infected by the dermatophyte. So here one can see the typical tinea corporis lesion, as one can see the circular ring, and here again one can see the circle ring and the margins. These are a bit edematous, and similarly one can appreciate the vesicule, the papule at the margin, but typically it looks like a ring-like appearance, and here also the margins are very clear, and that is giving you the appearance of ring. Now, tinea corporis continued. It is a rare fungal infection of the dermis due to the dermatophytes seen in more than 95% of cases. It rest of the cases, non-dermatophytic fungi such as Aspergillus, Candida species can infect, but in tinea it is basically the dermatophyte infection. Infection is mild to severe. Zoophilic dermatophytes, which are from the animals to the humans, like Trichophyton tonsurans, mostly responsible among the adolescents and young adults, those who are playing with the pets. Excessive heat, high relative humidity, and fitted clothing are blamed because there is less variation in that, and it is seen in the contact sports like the wrestling, judo karate and other in which there is body-to-body contact is more. Now, epidemiology. Disease is found throughout the world, but it is common in childhood, mostly pre-pubertal children. Children mostly contact zoophilic infection via contact with the pet animals like cats and dogs. Patients with a compromised immune system are also more vulnerable to develop this infection, especially Majokis granuloma. It's a type of Tinea corporis folliculitis that invades the deep dermal layers. Majority of the cases do not involve the dermal layer, but they are only lying at the superficial layer of the skin. Now, the sites which are mostly involved in tinea corporis, these are upper parts of the body like shoulders, axilla, armpit, neck, behind the ear, breast, chest, abdomen, and the back. Sometimes the face, legs, or the dorsal of the hands or feet are involved, but they have usually the different names as these are not particularly included and precisely included in tinea corporis. Now, here one can see the arms. These are having these tinea lesion, and similarly on the arm one can see the larger lesions, and on the legs one can appreciate the large lesions, and also here these are the lesions larger than this because they just unite together or coalesce together to form this form which I am going to tell later on in this lecture. Here one can see the lesion on the chest and the multiple small lesion on the chest, and similarly the large lesion on the abdomen, and these are also the different small lesion which are going to become the larger by uniting themselves on the abdomen. Similarly, one can have it in the armpit, on the breast, and on the neck, and on behind the ear. These are all the common sites. Now, what is the nature of the lesions? These occur as inflamed red ring lesions anywhere on the non-hairy smooth skin, that is called glabrous skin. Lesions are well marginated, as I have shown you the lesions. These are well marginated with raised erythematous edges, circular patches with advancing red vesicular borders, and central scaling is very pruritic. The annular scaly patches may collect to form the large area of the chronic infection, as I have already shown you. If Trichophyton rubrum is the etiological agent, these kind of the lesions, the larger, are seen. Now, this is the true fungal infection. As one can see, the true circular ring, and it is just one can see the central area is clearing, as one can appreciate, and it is sharply marginated, well margined. These are can be seen in the skin, that margins are there. Then on the margins there are certain scale, so that is the scaly area, that, and that is the elevated border on the edge of the lesion. So these are elevated. Sometime I have told you the small lesions like this, they just collect together, unite together and form the larger lesion, which are called polycyclic lesion, and these are also here at the buttock is called polymorphic lesion. There is no challenge more challenging than the challenge to improve yourself. So the best challenge for you is that you should accept the challenge to improve yourself rather than to accept the challenge of the others to make some non-serious decision. Now, what are the causes of tinea corporis? A tiny contagious fungal infection caused by the common mold-like parasites which are called dermatophytes. These live on the cells in the superficial skin surface, and when opportunity is right, they induce a rash or infection when the immunity is low. Three genera of the fungal group are involved. These are called trichophyton, epidermophyton, and microsporum. I used to ask my students to remember it like MET, M for microsporum, E for epidermophyton, and T for trichophyton. It's very easy to remember in this way. Most common etiological species is dependent on the method of the transmission to the patient. Anthropophilic species like Trichophyton rubrum is the common cause that is seen in 80 to 90% cases as the causative agent. Other include Trichophyton mentagrophytes, Microsporum audiani, Trichophyton verrucosum, and Trichophyton violacum. Here one can see the three major genera which are collectively called MET. So one can see this Trichophyton and one can appreciate the macroconidia of this, and there is microconidia of this fungus. Similarly, one can see the epidermophyton, and here there is microsporum, and one can also see the microconidia of this sperm. And to remember this met, that trichophyton is usually small, pencil shaped as one can see, and microsporum as one can see the spindle shape, and epidermophyton as one can see these are club shaped. Their margins are not as sharp as it is in case of microsporum or trichophyton, but they are club shaped, and for that reason it is easily to recognize by their appearance under the microscope. Now, the different dermatophytes which are responsible for this problem are Microsporum canis, which is having shape like this, then Trichophyton rubrum, and Microsporum audiani, and Trichophyton mentagrophytes, and here it is the Trichophyton verrucosum, and this is the Trichophyton violacum that has got the different appearance, and that is on the culture how they look like as one can. Now, continuing the causes, other species responsible are Trichophyton interdigitale, Trichophyton tonsurens, Microsporum canis, which is seen mostly in the cats and dogs. Canis is usually meant for these animals, so that is called Microsporum canis. And other zoonotic species, as you know, from the animal to the human, these are called zoonotic species. These include Trichophyton verrucosum from the cattle, Trichophyton equinum from the horses, and Trichophyton aniacei, that is from the hedgehogs. Infection from the Trichophyton tonsurans results from the direct contact with the Tinea capitis patient if the patient is already having the Tinea capitis, and from the contact with that lesion, that is the Trichophyton tonsurans, that can shift from that to the person who is not infected. Trichophyton tonsuran cause Tinea corporis gladiatorum, that is seen in athletes with extensive direct skin-to-skin contact, as I have told you, the wrestlers, the judo karate players, and the other sportsmen in which there is body-to-body contact is the part of that game. Trichophyton concentricum produce large concentric lesion, as the name is, so they are going to make the concentric lesions. Trichophyton pseudonens affect face and the neck that is seen in Sudanese and African people only. Now, Trichophyton concentricum is here. One can see that Trichophyton interdigitale, that is Trichophyton rubrum, Trichophyton mentagrophytes, Trichophyton tonsurens, Trichophyton schonlinii, and Trichophyton violaceum, Trichophyton ordinii, Microsporum canis, and Microsporum gypsum. And here there is Trichophyton pseudonens that is seen in Sudani people and in African countries only. Now, transmission of the disease. Number one is human to human by direct skin to skin contact with an infected person via infected scales, hyphae, or the arthroconidia on the skin which fall on that, and that is transferred from one area of the body to the another area also. That is, if a person is having tinea pedis, that can lead to the tinea corporis. Tinea pedis that is seen in the foot and that can be transferred, that is to the body part that is called tinea corporis. Transmission is facilitated by a warm, moist environment. Incubation period is 1 to 3 weeks. The moment fungus do attack the skin, it start growing after 3 weeks. Well, the dermatophyte invades and spread in the stratum corneum of the epidermis, but these are unable to penetrate deeper layer, that is the dermis layer in the healthy skin of the person. Now, the other mode of transmission is animal to animal, that is by touching the pet animals which are already infected with the ringworm while petting the dogs or the cats, and also seen in case of the cows which are being used and put in the house as a pet animal. It can be acquired from the other animals such as horses, pigs, ferrets, and the cows. Number three is object to the human, that is contact with inanimate objects or the surfaces which are called fomites. These are infected by person or the animal. The fomites are infected by the person or the animal, like clothing, towels, bedding, and the linens, combs, and the brushes are infected by the dermatophyte. These retain pathogen and transmit to a new host. And the next transmission mode is soil to the human. Rarely, but seen by prolonged contact with highly infected soil with dermatophyte. So one can see the pet animal responsible for transmitting the disease to the human. These are rabbit, tortoise, hamster, dog, fish, ferret, cats, and rats and other. And also by the fomites, by the patient who is already infected, who has touched these objects like table, like computer, like mouth, like bookshelf, like other doors, and the things which are being used by the infected person, these are all included in the fomites, and these are responsible for spreading the infection to the healthy human being. Now, there are certain risk factors in which this disease is more prone to cause the problem in the different person. Tinea corporis is found in most part of the world, but more in the hot, humid climates, subtropics and tropics, mostly seen in children and young adults, but all age groups can be infected, including the newborn. So there are certain risk factors. Number one is medical risk factors. These include previous or concurrent tinea infection, diabetes mellitus, immunodeficiency, seen in the patient of AIDS and HIV. Hyperhidrosis, so a humid and wet environment, as the people are going to having the profuse sweating, so they are going to have the humid and wet environment of the skin. Xerosis, the less, that is the dryness, that is also make the skin prone to be infected. Ichthyosis, lymphomas, Cushing syndrome, and old age group. These are all the risk factors. And as one can see from here, the increased sweating, the weakened immune system, and exposure to the hot and the humid weather in case of the areas like tropics and subtropic, then there are certain changes in the puberty, and that is more common in pre-pubertal cases, and the use of the topical skin and other factors which I have already mentioned. Now, number two among the risk factors are environmental risk factors. These are household crowding, living very close to one another, infection of the household members, keeping the pets in the house, wearing the occlusive and tight clothing, so no proper aeration, activities involving close contact with others like wrestling and other sports, and shared change room clothing like towels and other things which are being used by one and also by other. The third group of the risk factor is familial and genetic predisposition. It is mediated by specific defects in the innate and the adaptive immunity. I have already told you the immunocompromised person are more prone to have problem as compared to the immunocompetent persons. These patients have low defensive beta 4 levels, and they also demonstrate a predisposition to all dermatophytes, but particularly for Tinea imbricata. Now, what is the clinical presentation of the disease? Generally restricted to the stratum corneum of the smooth, hairless or glabrous skin, not going deep to the dermis usually. Symptoms due to the fungi metabolites such as the toxin and the allergens released by the fungi that cause mild itching. A lesion spreads out from the center, forming a ring-shaped appearance, and there is central clearing area and central hypopigmentation. And there is a peripheral scaly red rim which gives you the appearance of ringworm. Skin lesions are pink-red, scaly, annular patch with expanding border, or as papules, small plaques with mild edema with a clear area inside the ring. So here one can see the central clearing area and the raised edges, and there is a sharply marginated area, and here on the that is margins there are scales, and one can see that is annular ring shape appearance, and that is being caused by these dermatophytes. These are microsporum, trichophyton, and epidermophyton, which are collectively called MET. So, enlarged, and these lesions are, these do enlarge and form expanding rings, arcs, or annular pattern with central clearing area. With time, multiple lesions develop which coalesce or unite together to form a polycyclic pattern. I have shown you already the slide of that. The distribution of the lesion is typically asymmetrical and not on equal on the both sides of the body. Resolution of the redness and the edema lead to the scaling on papules and plaques, vesicles, papular, pustular, or the blister in lecture, lesion are also seen. Always there will be hair loss in the area of the infection. Now, what are the types of the Tinea corporis? These are the clinical variants of the Tinea corporis. Number one is the chirion. It is the intense pustular inflammatory reaction due to the zoophilic fungi. Number two is Tinea gladiatorum that affects the participant in the contact sports like as wrestler or martial art athletes. It is because of due to skin to skin contact, lesions on the neck, back, and arms are mostly seen, usually caused by the trichophyton tonsillense. Third type is Tinea imbricata. There is extensive concentric rings forming polycyclic plaques with the thick scale and very itchy caused by the trichophyton concentricum. As the name is, these are going to make concentric rings. The fourth type is bullous tinea corporis. It is a rare variety and present with the vesicle or the blisters as the name is. So these are the bully formation there and it is caused by the tinea rubrum. So here one can see the chirion, the inflammatory tinea corporis, very intense and it is involving the hair follicle also. And here is Tinea gladiatorum, which is seen in athletes and the martial art people because of the skin to skin contact and having the lesion. This is Tinea imbricata, as one can see the large lesions, large size rings, and here is the bullous Tinea corporis, as one can see the bully, and here also on the fingers one can appreciate the bully. So the name is bullous Tinea corporis. The fifth type of the Tinea corporis type is Majocchi's granuloma, which is abbreviated as MG. It is a variant involving hair follicles and subcutaneous tissue, mostly found on the limbs after shaving, and it presents as perifollicular papule or the pustules. Usual organism is Trichophyton rubrum. Other responsible are Trichophyton mentagrophytes, Trichophyton tonsillense, and Trichophyton violaceum. The sixth type of Tinea corporis is Tinea incognito. It lacks typical feature of the Tinea corporis because of the suppression of the inflammatory reaction by using of topical corticosteroid or topical application of the corticosteroid or calcineurin inhibitors. So there is no inflammation there. Lesions are widespread with poorly defined borders, lacking scale and erythema. That is all because of suppression of inflammatory reaction. So here one can see Majocchi's granuloma with lot of neutrophils and inflammatory cells and folliculitis, that is a type of fungal folliculitis, and here one can also appreciate the nature of the lesion, and here there is Tinea incognito because of suppression, and there one can see the nature of the lesion in Tinea incognito.